Hello everybody. Today we are talking about the power of laser treatments. Are you in your menopause era and starting to notice your skin looking dull, you're dealing with uneven tone, rough textures, and on top of that you have also started noticing a loose skin around your face. I have been there. I went through the exact same thing in the last 2 years, and that kind of forced me to find real solutions that I got from working with my dermatologist and doing lots and lots of research. Whatever I am discussing today, this goes hand in hand with your at-home daily skincare routine, your at-home devices that I talked about in my last video, which I will link below. This is in addition to the things that you are doing on daily basis. This is by no means a replacement. This is when you want to bring the big guns in and you want to up your game and you have optimized your skin through your daily skincare routine. As I was saying, I went through those changes. One day I woke up and I was looking like this. This is very scary. I went back and forth about sharing this picture because this triggers something in me because when I woke up, I looked into the mirror, I saw my grandma, I saw my mother, which is people I love, but I was not ready to look that way. Later when I analyzed, the problem was that my inside was not matching up with how I was looking outside. That's when I started looking into all the tools, resources available that can help me. It's just what I'm trying to say. It's just more than vanity. It's just more than you just looking good. It's actually psychological, and it happens right in the middle of when you're going through so many changes. Your hormones are changing, your family dynamics are changing because your kids are growing old, and your things at your job are getting pretty serious because you, if not, most likely you are at the top tier of wherever you're working, and that's a lot of stress. It's the stress, change dynamics of your family, plus your body, and then you there's a mismatch between how you feel inside and then how you look outside. Hi, I'm Dr. Sophia Kiran. I'm a clinical life scientist by training with 20 plus years experience in cell and gene therapy, and now my passion is to help women, especially Desi women, navigate perimenopause through science-backed solutions and self-advocacy. You can call me a problem solver for everything perimenopause. As you grew up in 80s and 90s like I did, chances are you played outside for hours without sunscreen, and there's no shame in that. We all did. Use of sunscreen was minimal back then, and I grew up in Saudi Arabia. You can just imagine the scorching heat and sun, and we used to play outside like for hours. The sun damage happened at that time, but what happens is that it does not show up until years later. The skin damage start catching up when we are in our mid 30s, late 30s, again around the same time when all the other changes are happening in our life. In a way, the sun damage start catching up with us. It starts showing up in our mid 30s. At the same time, a decrease on your collagen production also starts to show up. With the collagen production, it peaks around 21 and 25 years of age, and after that, it drops by 1% every year. By the time you're in late 30s, early 40s, you will see subtle changes in your face, and those will be one of the changes where you cannot pinpoint, but you know you look different. Those are collagen related. The one that you can see are the ones that are like sun damage, and that's very devastating, and it plays with your self-esteem, and you become conscious. I think it's very important to at least be aware of the tools available for you to deal with these problems. Your collagen drops becomes faster. It expedites when you hit perimenopause. You start seeing dark patches on your cheeks, your forehead, around your nose, and sometimes you see the darkening of your skin around your mouth area. And I don't know if you remember, the exact same thing happens during puberty, in your early teenage years, and that at that time usually because of the peaks in hormones or changes in hormones. Now in perimenopause, the hormones still plays a role, but again, all the other damage that we have accumulated throughout the years in our 20s and 30s starts also keeping up. It's like a mixture of everything. Good news is there are solutions. Laser technology can help with all the skin changes concerned. We have discussed. But here's the thing, in our South Asian community, especially Desi community, I have experienced that lasers can feel intimidating. A lot of people avoid them because of certain fear or confusion. And after looking at the research and also talking to some of the people in our community, I feel like I have an idea why this has happened. We're going to discuss that. There are two terms that I want to go over that you hear repeatedly when you talk about lasers. The first is fractional, non-fractional. This term is only used to define how much of your skin area is getting treated. If it's 100% of the skin area, it's called non-fractional. If it's just the parts of it, it's just 20 or 30% of your total total treated area is called fractional. Fractional lasers treat tiny sections. You get great results with less downtime. That was first term. The second term that is used in relations to lasers is ablative and non-ablative. Ablative lasers remove the top layer of the skin. Non-ablative lasers, they work underneath your top skin, so it doesn't touch your surface, but it goes deeper and use either the thermal energy or radio frequency or some kind of energy to kind of stimulate your fibroblast, which in turn increase the production of some key components or key constituents of your skin like collagen and elastin. Now, ablative, non-ablative, they both stimulate collagen. Ablative therapy is more intense, more downtime. Your results will be a lot better than when you use a non-ablative one. Usually what happens is that you do 2 or 3 sessions of non-ablative lasers, which usually equals to one ablative laser session. What is laser? Laser stands for light amplification by stimulated emission of radiation. That's a mouthful, but we don't have to learn the physics behind it. What really matters is that we understand the following. The laser are specific wavelengths. You start with the white light. So the white light is a combination of different wavelengths. Laser is just one specific wavelength within that light. And that laser focuses on a targeted area on your skin. And that target on that skin is called chromophore. What chromophore is being targeted by the laser depends on the concern of the patient. What is your concern? And we're going to go over 3 major concerns so you can understand what is being targeted and then what kind of laser is being used to treat that condition. The entire objective of this video is not to get too technical, but for you to know the basics. When you're ready or if you're interested in getting a laser treatment, you can just walk up to your specialist. You'll know exactly what your concerns are, and based on that, you can have a very educated discussion with your specialist about what type of lasers is being used, what is the chromophore, the wavelengths being used, and if that is the right laser for you. Let's break down lasers based on the concern. Concern number 1 is acne scars and skin textures. So the laser used to treat scars and skin textures are the most intense one. That means that has the most downtime. It has more aggressive pain management protocols included. So these lasers target water molecules. And since the water molecule is found throughout your skin layers, the treatment area is pretty large. Some options for the lasers that target water and used to treat scars and skin textures are CO2 lasers. The example of CO2 lasers will be Fraxel repair or smart ride. These are called fractional ablative. Fractional means they are only treating fraction of your skin. Ablative means wherever they are treating, they are vaporizing the top layer of your skin. The other example besides CO2 laser is Vbeam lasers. An example under this category would be Cyton profractional lasers. These lasers are a little bit gentler than CO2. These treatments do require numbing and some pain management or a whole anesthetic protocol because, like I said, they are very aggressive. They're usually paired with some other procedures, for example, plastic surgery. Most of the plastic surgeon recommend that after the patient have plastic surgery, they would go for full face CO2 lasers. They are very intense, but the results are phenomenal. You can just imagine, so your entire top layer is gone, and then you let your new top layer regenerate, that is without any problems like your wrinkles, your pigmentation. You essentially have a baby skin, but the downtime is between 2 to 3 weeks minimal, and you have to really take care of your environment, make sure it's sterile as much as possible. You are not coming in contact with anything that can cause infection. The downtime is one of the reasons why this is something that people do not opt for, but it's available. It's something that you want to look into. As for the pricing, Fraxel repair can range between $800 to $6,500 per session. And remember, depending on the condition and what you are planning to achieve, it probably is more than one session. And the pricing for a Smart Ride can vary between $1,200 to $3,000 per session. These are very expensive. Again, the pricing depends on location, provider, and how much area that you are treating. Concern number 2 is discoloration and pigmentation. In my experience, this is one of the most prevalent issues that we have in our community. But here's the tricky part. In our community, since we have skin of color, we have to be very careful whenever we are going for a procedure that helps with hyperpigmentation. For that, you have to look at your skin type. I don't know if you guys are familiar with Fitzpatrick skin type. This is the skin type scaling that's based on your melanin content, how fair or how dark your skin is, and also on how your skin reacts to UV radiation. It has the 6 skin types, starting from type 1, which is the most fairest, to all the way to the most melanin-rich type 6. If you are skin type 3 or higher, like most of us are in the Desi community, the wrong laser can make pigmentation worse. What should you do? Always choose a provider that is a specialist in treating skin of color. Ask questions, request before and after pictures. The safe laser option in this category includes Q-switched lasers. And 2 brands under this type of lasers is Spectra or Rivlight. Another type of laser that's very famous is Pico lasers. I don't know if you heard about those. Those have become really famous. They are based on your yellow beam lasers, and they have a specific wavelength. I think I have notes over here. They operate around 533 nanometers. And the cool thing about those is that they hit your skin for picoseconds. That is 11 zeros between the decimal and 1. So it's 10 to the negative 12th of a second. The speed is so fast that it cuts down on the negative impact of the laser that can cause problems with the pigmentation and only delivers the benefits. And that is that it goes in, breaks down the melanin, so your body can just absorb the pieces. There's also one thing you can do whenever you are getting a treatment for some kind of pigmentation. Either it's lasers or it's a peel. Peel is another thing that people opt for when they're trying to lessen the pigmentation. It's just the peel is not that sophisticated. It's like it covers all of your face. So the laser is very sophisticated. Just targets the area of concern and leave the rest of your tissue alone. To prep for these kind of procedures 2 to 3 weeks before, you can use certain ingredients that suppresses the melanin production. To keep things simple, the melanin is produced in 2 steps. First step is tyrosine is a molecule that converted into melanin, and for that conversion you need an enzyme called tyrosinase, and then this melanin is transported from the deep layers of your skin to the upper surface of your skin. What are those ingredients that you can use to kind of suppress the melanin? And these 2 steps, either you stop the conversion of tyrosine to melanin or you stop the transportation of the melanin to the top layer of your skin. Those are alpha-arbutin, kojic acid, licorice root, and tranexamic acid is the one, and niacinamide. Now, there are a lot of products on market that kind of combines all these things, and I think the best thing for treating hyperpigmentation is that you have to throw a sink at it. You have to combine a lot of things where they're working at different levels, and then you will start seeing improvement, and even that is very slow. You will give yourself at least 8 weeks before you can see changes. Again, those ingredients that I just went through, they help calm your pigment cells so they don't overreact to these treatments like lasers and peels. Concern number 3, those are broken capillaries and redness on your face. This is where the laser that we're using will target hemoglobin. So your chromophore is hemoglobin, and that's a pigment in your blood. The laser in this category is called the Vbeam. Vbeam is a pulsed dye laser that sends out yellow light to destroy broken blood vessels. Your body then clears those out naturally. I think Vbeam is one of the most underrated lasers, and I think this is also one of the secret weapons a lot of influencer celebrities that operates in the skincare sphere. For example, Dr. Idris, Dr. Stephanie Kappel. Whenever you look at the videos, you feel like they're using a filter, but I think they're not, because you look at their lives and they bring the camera very close to their face and you can tell they still have this very smooth porcelain look. And I think Vbeam has something to do with it, because this laser kind of gets rid of all the natural redness that you kind of start having, especially in the perimenopause era. Your cheeks around your like nostrils, this is where like my problem area is. And now what I've started noticing, that I can actually see my capillaries right my in my under eye. That's something that I'm highly interested in, and so the Vbeam is great for treating conditions like rosacea, spider veins, port wine stains, acne-related redness, and also you can use it for the discoloration on your neck. And the bonus, like for all other lasers, is that it boosts collagen. That's whenever you get any laser treatment, it boosts your collagen production. What if you don't want to get laser done for any specific concern, or just, you know, how they call it, you want to get a laser facial or a glow facial? These lasers exist. They're not that intense, but they give you a very gentle results with a minimal downtime. The first example that's most famous under this category is Clear and Brilliant laser. It uses two wavelengths. The first one is 1440 for fine lines and pores, and then it's 1927 nanometer laser. That's for pigmentation and sun damage. 1927, you might want to remember that number, because there's a lot of lasers that uses this. And you want to use this wavelength because that's the one that's going to treat or target your pigmentation in getting rid of the sun damage. And so this laser is fractional and non-ablative. And now you guys know what fractional means. It means that treating fraction of the skin. As non-ablative, meaning there's no vaporization on the top layer of your skin. The laser is working at the deeper layers, so it's milder. For price wise, expect to pay around $500 to $750 per session. Again, it depends on where you're located, your experience, your provider's experience. Usually for these kind of lasers, the multiple sessions are recommended for best results. The other laser in this category, which is not technically a laser, it's just a light, is called IPL and BBL. So IPL is intense pulse light, BBL is a broad band light. They are light based treatments, they're not lasers, and they're great for mild pigmentation and sun damage. For me, I think of them as a seasonal maintenance. You're still doing your daily skincare that is minimizing production of melanin, hampering the transfer of melanin to the surface. You are doing your peptides, your growth factors. You are using sun protection. So every once in a while, when the melanin still manages to creep up and it start to show on your skin, it's like raking leaves. You go in there once every year or once every 2 years and just take care of these. Again, with the deeper skin tones, be very cautious with the IPL and BBL. These treatments can affect melanin and blood vessels. You have to make sure your provider is the one who knows how to treat people with skin off color. Pricing wise, they usually are between $300 to $600 per session. Again, multiple sessions are needed if you have a lot of pigmentation that needs to be treated. Hopefully, laser treatments are not scary anymore. I tried to provide you with the basic information, and I want to let you know that lasers are not off limit. You can still get laser treatment. You just have to make sure that you are working with a provider that has a lot of experience with skin of color and is honest. The person should be able to look at your skin and tell you if that is not the treatment for you, and then show you alternatives. Again, don't forget the basics. You have to wear your sunscreen every day, because there's no point of investing in all these treatments if you're not going to protect your results. Tell me, have you tried laser treatments? Are you still thinking about it? You still have some questions, or you have some experiences that were not good, but you think sharing them might help your community members? Drop your thoughts or comments below. I would love to hear from you. And if you found this video helpful, please go ahead and like and subscribe it. I'll see you in the next one. Thanks. Bye.